There is a strong link between high salt intake and the risk of diabetes. This is because salt, sodium, can raise blood pressure, which is a major risk factor for diabetes. High blood pressure can damage the blood vessels and make it harder for the body to use insulin effectively. In addition, high salt intake can lead to inflammation, which is another risk factor for diabetes. Inflammation can damage the cells in the pancreas that produce insulin. Several studies have found that people who consume high amounts of salt are more likely to develop diabetes. For example, a study published in the journal Diabetes Care found that people who consumed the most salt had a 50% higher risk of developing diabetes than those who consumed the least salt. Another study, published in the journal Circulation, found that people with high blood pressure who reduced their salt intake had a 25% lower risk of developing diabetes. The American Heart Association recommends that adults consume no more than 2,300 milligrams of sodium per day, and people with high blood pressure or other chronic health conditions should consume no more than 1,500 milligrams per day. Here are some tips for reducing your salt intake. Cook more meals at home so that you can control the amount of salt you add. Choose fresh or frozen foods over processed foods, which are often high in salt. Limit processed meats, such as bacon, sausage, and ham, which are also high in salt. Rinse canned vegetables and beans before eating them to remove some of the salt. Use herbs and spices to flavor your food instead of salt. Read food labels carefully and choose products that are low in sodium. By reducing your salt intake, you can help to lower your blood pressure, reduce your risk of diabetes, and improve your overall health.